This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about what to do if you broke your thumb. So the thumb has two bones in it. There's a proximal and there's a distal phalanx, or two little finger bones. The question is what to do if you broke it. So a general rule of thumb, or also with finger fractures, is that if the bone angulates, meaning that when you break it, it does one of these more than 10 degrees, or if it shortens, meaning that it does one of these more than 2 millimeters, or it's rotated, then usually that requires surgery. So if you broke your thumb and it's sticking out a crazy direction and pointed all weird, that's probably going to need surgery. If you broke your thumb and sometimes you break the bones, they don't move too much, and it's not rotated, it's not angulated and not shortened, you may be able to get away without surgery. And you can tell if it's rotated if kind of you bend your thumb and you compare your two thumbs where they're supposed to bend. If one of them is going all strange directions when you bend it, then it may very well be rotated. Usually if it is broken and does need surgery, it's recommended that you get it. If you don't, especially with a thumb, you can compromise your hand function long term. If it doesn't need surgery, then a lot of times you can get away with splinting it. Generally with fingers, there's not too much space in the finger, so when bones break and they heal, sometimes you can end up with a really stiff finger. Now there's a little more space in the thumb, but generally speaking, you don't want to immobilize a thumb for too long, and the goal is to get it to heal whilst mobilizing it for a few weeks and then starting to move it. And if you're unsure of whether you broke it or not, an x-ray will always tell you that. But if it's purple or blue and it hurts and it's pointed in a funny direction, then you probably broke it and should get it looked at. So I hope I was able to answer your questions about what to do if you broke your thumb. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But know that I can't give you medical advice about your specific condition over YouTube. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.